Ron Wyden here, and welcome to a very special conference on mental health and the law. A big thanks to the Mental Health Association of Portland for hosting a very important event. Mental health is the premier issue for millions of Oregon families. I've long said that if you or a family member doesn't have their health, everything else goes by the boards. That's just as true for mental health as physical health. Current events have cranked up anxiety and other mental health challenges to 11. That's why I'm now working on a bipartisan basis as chairman of the Senate Finance Committee to draft legislation to address key shortfalls in the mental health care system. One shortfall I've already been working on is the issue you're going to discuss today: the relationship between law enforcement and Americans experiencing a mental health crisis. The national discourse surrounding racism and policing has created a renewed urgency to reimagine public safety. Fortunately, here at home, we have an Oregon model to draw on for decades. The Cahoots program in Eugene, Oregon has demonstrated that there's a way to decriminalize mental health and make sure people get the mental health care they need. That's to help those who need mental health care avoid winding up in jail or worse, tragic encounters with the police. As chairman of the Senate Finance Committee, I've led the effort to fight for federal funding for these programs through the Medicaid system. Earlier this year, I was proud to secure $1 billion in Medicaid funding in the American Rescue Plan for mobile crisis services. That's now law today, and I'm pleased to be able to say that because of my provision in the American Rescue Plan, Oregon has already gotten a jump start with $1 million as a planning grant in September. These dollars will help Oregon build on Cahoots' great work and expand mobile crises programs statewide to help meet the needs of Oregon communities. These innovative and successful approaches to public safety and healthcare are a true example of the Oregon way. I'll continue to push to take this model national and to make sure Oregonians have the right resources to get the care they need. I'd also like to give an additional shout out to Whitebird Clinic for helping over a dozen other localities in our state and across the country jumpstart Cahoots type programs. Thank you again for all your leadership, and I wish you well as you discuss and plan additional ways to improve mental health care and reduce violence.